Are you tired of dealing with painful foot and ankle conditions such as bunions and hammer toes? And maybe you've heard the horror stories of bunion surgery and hammer toe surgery. Trust me, I hear it all the time from all my patients. But imagine having maybe you need a bunion correction or a hammer toe correction, but you've been putting it off for so many years because of all the horror stories. Stick around, we're gonna discuss a technique known as minimally invasive foot surgery, where the procedure is performed through a small incision, but also allows you to walk the same day. No casts, no boot, no crutches, no cane. If that's something that's piquing your interest, stick around, we're gonna talk about it right now. Hey guys, welcome back to my channel. I'm Dr. Ashwin Wadera, minimally invasive foot surgeon and regenerative medicine specialist. Today we're going to talk about minimally invasive foot surgery. I'm very, very passionate about this topic and procedure. It's helped change so many of my patients' lives, and I do believe it could be helpful for you. We're going to dive deep today in this video to discuss exactly what is minimally invasive foot surgery and is it right for you. Minimally invasive foot surgery has transformed my practice. More importantly, it's transformed so many of my patients' lives. It's truly a game changer in foot and ankle surgery, and I really think it's going to benefit you as well. So you're probably wondering, what is minimally invasive foot surgery? Well, it's exactly what it sounds like. It's an incision that's made on the foot, 3 millimeters or 1/8 of an inch, and I'm able to help correct the issue at hand, whether it's a bunion or a hammer toe, maybe it's a painful bone spur that you're dealing with. Everything is done through this very tiny poke incision, also known as a keyhole incision. And the great thing about this procedure is that it's done right here in our office-based surgical suite. There's no need for a hospital, and there's no need to go to a surgery center. All my patients walk in day one in a surgical shoe, meaning there's no cast, there's no boot, there's no cane, there's no crutches needed, there's no knee scooter needed. Everything is done through this really small incision, and we don't use any orthopedic hardware, pins, plates, or screws. So what are the advantages of minimally invasive surgery? Well, there's so many, but let's kind of go in order of some of the more important ones. Number one, minimal pain. Why is there minimal pain? Well, everything is done through a very tiny incision. So we're not really creating any trauma to the surrounding tissues. So what do I mean by that? Typically with traditional open surgery, we have to, when we do the incision and we get down to the bone, we have to actually move all the other structures in the area. The tendons, the nerves, the blood vessels, so that they don't get injured during the procedure. If we don't move them out of the way, what can happen is that the knife can cut through those areas and now we're having problems. But when we move them out of the way, also known as retraction, when we retract these structures out of the way, that in and of itself causes a lot of trauma to the area, causes a lot of swelling, a lot of pain. So after the surgery, once the surgeon puts the sutures in, there's a lot of swelling that happens, and then oftentimes the patient's in with a lot of post-operative pain. We minimize all that with minimally invasive surgery because we don't have to worry about those vital structures because we work around them through a very, very small incision. Not to say there isn't any pain with minimally invasive foot surgery. There is sometimes, and there's sometimes some swelling. Usually it's not as drastic as it is with typical open surgery. Number two, less chance of post-operative infection. Because we're not creating such a big incision on the foot, there's less likely to have bacteria that comes into the area. Oftentimes with a big incision, the foot is open to the world, and in our air there's bacteria. It's very normal, and that can get inside the foot. But with a small little incision, only 3 millimeters, the likelihood of infection happening is very, very minimal. Of course, we take all the proper care and all the necessity to make a sterile environment. We also make sure our patients take antibiotics afterwards so that they are not risking a post-operative infection. And of course, all of our equipment is sterilized so that we minimize the risk of having a post-operative infection. Oftentimes, patients deal with swelling after traditional foot and ankle surgery, and this can last up to 1 year in some patients. It's not unheard of to have someone have a bunion surgery, and 1 year later, the swelling is gone. Oftentimes, patients are coming to us saying that they can't fit in a shoe because the bunion is so painful and big, and then after the surgery, they still can't get in the shoe because of how much swelling there is. I hear it all the time. With minimally invasive foot surgery, oftentimes we're minimizing that swelling, and patients are even able to get back to shoes much sooner. It is not unheard of in minimally invasive foot surgery, specifically with bunions and hammer toes, for patients to be out of that post-op shoe that we use and back to a regular shoe within 3 to 4 weeks. It's common to see that. Versus traditional open surgery, where oftentimes patients are off their foot for maybe up to 12 weeks, transitioning from boot to maybe like a bigger shoe, and then eventually regular shoe down the road. We minimize all that with minimally invasive foot surgery. Number 4, blood clots. A blood clot, it can be life-threatening. And a blood clot is where the patient has not been walking for X amount of time and a clot forms and it blocks the circulation. This can be life-threatening because it can go to the heart and it can go to the brain, and this can kill somebody. Usually this happens when the patient has not been walking for some time. Sometimes they're maintained on a blood thinner, which in and of itself can be dangerous. However, with minimally invasive foot surgery, patients walk the same day, immediately after the procedure. The procedure's over, we put them in a shoe and they walk right out of here, promoting healthy blood flow and preventing a blood clot from forming. Number 5, everything is done under a local anesthetic, meaning nobody goes to sleep for this procedure in our practice. And it's the equivalent of going to a dentist for a filling. If you've ever had any dental work done, you know that you're awake for the procedure and the dentist will go ahead and numb the jaw. We do something very similar, but it's done on the foot. A lot of patients have anxiety when it comes to being put to sleep. I myself have anxiety when it comes to anesthesia. And so now that we're able to simplify that and do it while the patient's awake under a local anesthetic, it's a great environment for the patient, less anxiety for the patient. And you might be wondering, well, I'm awake, am I going to watch this procedure? No, we block you from the procedure. We put a screen up, but we make the environment very comfortable for you. My staff is in and out of the room, making sure you're comfortable. Oftentimes patients has their phone with them, which is something we encourage. And I also joke with my patients, I actually get to know my patients best during surgery because they're awake and I'm on the other side of the screen and we're getting to know each other very, very well. Number 6, aesthetics. Now, in foot and ankle surgery, aesthetics is second, but we live in an era now where everybody wants to look their best, whether it's their face, other aspects of the body, but also the foot now. Well, the great thing about minimally invasive foot surgery is that oftentimes there's really no scar that's left. And if there is a scar, it's minimal and you oftentimes can't even see it. Versus a long incision that's on the foot, oftentimes it leaves a big scar for patients. Depending on the skin type, it can create what's called a keloid scar. And they can look unsightly and sometimes they can be very painful. We minimize all that and we reduce the likelihood of that with the use of minimally invasive foot surgery. So with all those advantages that we discussed, common conditions that I treat here in this office are bunions, hammer toes, bone spurs, even heel pain, if we need to operate on that, and even corns. A lot of times patients come with very, very painful corns, whether they're on top of the toes or they're on the inside of the toes, especially near the baby toe, the 5th digit. I see it all the time. We're able to correct a lot of these issues with the small incision surgery. And again, you walk the same day, which is, again, unheard of in foot and ankle surgery. We've minimized all that for our patients, minimized that stress. And oftentimes, I hear it all the time, Mom had a bunion 30 years ago, and I've been putting off my bunion surgery because I saw what she went through, or a friend or a grandmother. I hear it all the time. And again, it doesn't have to be that complicated, and I'm here today to help you minimize that anxiety so that we can take you out of your pain, get you walking same day so that you can go ahead and provide for your family, get back to doing the things that you love, because that's important for you, and it's my job to help you with that. So guys, I'm Dr. Ashawadera, minimally invasive foot and ankle surgeon. If you think you're a candidate for this procedure, or are you wondering, are you even a candidate for this procedure? I want you to click the link in the description below and set up a consultation with me. I have helped people all over the world with these conditions, and I want to help you as well. Also, like, subscribe, and comment below. If you have any questions, comment below. I'll get back to you, and I'd love to see if I can help you out here. Thanks, guys.